And then I just give it like a little pre-tension and follow it through.
Oh,
Holy that was intense.
It was really good. Never had that. I've had a lot of trauma. I adopted 3 children from China. I was so close to one of them, and she hasn't wanted anything really to do with the family for about 14 years. I just miss having her in the family. I can't reach hardly without severe pain. It just drop. Like if I go to somebody's house, give me the cheapest glass you have, because I'll probably break it. It was in so much pain. And they were wanted to operate right away. And the surgeon said, you know, you could die from this surgery. And I would just cry thinking about coming here, thinking about the release. My shoulders, I can't get relief, and pain down my arm, just, you know, if I'm in bed or anywhere. I mean, it just, I can't reach hardly without severe pain. It just, I know I have a slap tear in there and everything, and the doctors want to do total shoulder replacements, which I don't want to know. Just that constant pain and the numbness, I put things away at work and I'm drop. Like if I go to somebody's house, give me the cheapest glass you have, because I'll probably break it. And I have restless leg syndrome, and now when I get in bed at night, even though I take potassium, magnesium, everything, it's like they cramp up the toes, and sometimes they, on their own, just and get crampy.
Start to crinkle up.
And I get cortisone shots every 3 months, but they're really not working anymore.
It's kind of like a Band-Aid fix.
Yeah.
So, I mean, overall, systemically, there's a lot of imbalance happening with your body.
Yes.
Body's so resilient. It heals itself in so many ways. Sometimes it just needs a little kickstart.
Good. I'm here for the kick.
Yeah. Let me have you walk around the table once, because I know we were talking about your walk earlier.
It's like I seem to walk right to left, and I can't get it under control.
Yeah. You got like a little gangster walk going on here.
Yeah, I do.
Yeah.
You know.
Yep. And then you're going to lift them up above your head. Okay. So definitely that left one doesn't get us far. So this one's much more forward in front of this one, right? And then try to do the same thing up over your head. Try to touch the backs of the hands if you can. So definitely left side's much more restricted. When you feel resistance, stop. Okay, so you can get pretty far about there. This one's less. Your right side's definitely not going as far. Let me have you, you're gonna bring your hands up like this onto your hips, kind of like a superhero pose if you can. Hold strong. I'm gonna go here.
You want me to resist you?
Yes, please, actually. Oh,
wow.
Oh.
Wow. Oh,
yeah.
I feel that. Oh, wow, that was cool.
That's definitely a lot of muscle.
Bump, 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 bump.
So pec, your pec here.
Yeah.
You're gonna do a little bit more work through your pec. Yep.
Yep. Oh, shoot.
Wow.
Right, almost said it.
Yep. Hold there.
All right.
Good.
Wow, that was cool.
Whew. That was nice. Let's see. Is that pressure okay? I'm gonna put a little bit more pressure. Oh, that was a nice little shift. Aha, see, like that one was a little louder. And then I kind of see how your spine moves. Kind of like a little pre-check. So that feels like it moves pretty nicely. Tuck your chin in, Susie, and then let that relax. Good. You kind of just follow it. Oh,
Nice.
that was great.
Yeah.
So you're gonna feel a pull. Pull. That was good. So in relation to your sacrum, your bottom lumbars shift over to the left side. So you gotta kind of like do the opposite of that and then bring your right hip down because it is way too high. Great, I got you. You're gonna feel a little drop maybe a big drop. Now the other big drops. Let me have you go face up on your back. So we're gonna bring your leg down. Yep, let it drop, let it drop. Okay. You're not gonna fall, promise. I got you locked in. Great. Let that hip fall, let it keep falling. Good. Let it keep going, going, going. And I dropped the mic, nice. Okay. Has anybody ever adjusted your feet as well?
No, but I would love it.
Cool. Well, let's do it. So a lot of the imbalance that you're having too can come from the feet. So let's do a couple of adjustments here. Good. Now we're gonna do midfoot. Nice. Turn this way. Good. You're gonna feel a little push. Aha!
Nice.
How was that? That was fun.
Nice.
Do both sides, why not? Bring this up. Good. Good, you're gonna feel a little push. Much better. Okay, move those around a bit. How's that feel?
Good, very good.
Bring this up and let's see, it might be a little limited, so let's do this. I'm gonna have you hug this.
Okay, thank you.
There you go. Nice. Hold tight a little bit there. Right there. Good. Relax your shoulder blades. Nice. Another one like that. Good. All the way out. Yeah, there it is. Good. Oh, that was nice.
Nice, nice. Oh.
Let's do a little bit more for your shoulder here. Bring this arm up. Let's see. I'm gonna have you roll a little bit. All right, so this is gonna be for shoulder ribs. Good. Whoa. That was that was good. Yeah, how was that, Susie? Yeah.
Sit up.
Yeah, of course. Come up. Oh, that was
I did. Sometimes I get
Yeah.
vertigo. That was really good.
That was so good. Here, let me get you a tissue here.
Thank you.
Because I know your shoulders are a big
Just
part of the problem.
Constant.
How did that release feel? Because that was some pretty good movement.
It all felt at once. Yeah, it felt really good.
Good. I'm glad. I know that's a big part of like what brought you here.
I would just cry thinking about coming here. Thinking about the release, you know?
Yeah. And everybody's healing process is going to be a little bit different. So it's always, you know, that's why we want to offer this healing space and just let you feel what you feel.
Yeah, thank you.
You're welcome.
I'm happy.
Good, good. We got to make your trip worthwhile.
Right.
Yeah, because we really appreciate when anybody comes even from down the street. I mean, just coming in, it's like it's always an honor for us. So, yeah, thank you for making the trip all the way
Oh, you're welcome.
from Michigan. Does that feel good?
Yeah, that's very good. Thank you.
Yeah, you're welcome. Let's do the other side too.
All right,
Yeah.
Sure.
Let's,
Here we go.
Let's even it out. Let's keep the momentum going. Bring that shoulder up. Yeah, lift your arm up a little bit for me. Yeah, right there. Good. One more. Let that go. Sweet. There you go.
Wow.
I like the instant jolt. Good. I'm glad.
It's so hard to describe, isn't it? It's just like, wow. I don't know, it triggers your emotions, you know? And it just triggers all the time. You've been feeling bad.
Yeah. But, well, you've been feeling this stuck for, you said you're about 15 years is what you put on your paperwork.
Right.
So, I mean, like, when's the last time that you can remember just feeling at ease or normal?
15, 16 years.
Yeah.
Yeah.
What do you feel like triggered this? Do you feel like that was an incident or injury?
Well, I'm really into gardening, so I had a lemon tree in my backyard in Palm Desert, and I was obsessed with this, trimming it, and I think the bump and I feel like it accelerated when my head hit the roof of the car.
How did that happen?
So the driver was going through Riverside, and you know how they have those dips after the light? She just went a little too fast, and boom! And I didn't feel anything right away. I was just shocked, and then about 2 days later, COVID started, and I was visiting here, and I had to go to the emergency. I was in so much pain, and they wanted to operate right away. And the surgeon said, you know, you could die from this surgery. We have to go around the carotid artery. And I'm like, what the heck? They had me in the trauma center at Desert Regional, and he said, or we could try to do steroids till you get back to Michigan and find a surgeon. I said, well, let's do steroids.
Yeah.
So I was in bed off and on for about 3 weeks, but the steroids did help. And then I went to a neurosurgeon in Michigan, and he said, well, it's healing. They kept doing MRIs. He said the body heals itself a lot. But then he retired, and I just kind of, the last 2 years, haven't gone into a neurosurgeon to see the update.
They were just monitoring it? They didn't do anything else?
No, they didn't do anything. I went to a physical therapist, and it just didn't do anything. And one of the physical therapists said, I think you need to go see a chiropractor.
Oh, all right, hey.
Didn't want anybody else in the office to hear that, right?
That's a good PT.
They would tape it, they would adjust it, nothing helped.
Yeah. That's a journey, because, I mean, they right away wanted to go straight to surgery.
Oh my God, yeah.
Yeah, a lot of times, like, it's just like, they kind of like pass out surgery kind of like candy.
Right.
It's just like, you got to do it for this, you got to do it for that. Ultimately, structurally, your body was just like in this state of like stuck sympathetic.
Yeah, exactly.
Because hitting your head like that, that's a big trauma. I'm sure you got a minor concussion, whiplash.
Right. Yeah.
That compression too is what we see here in your neck. That instability that we were talking about, right?
Yeah.
Your neck kind of looks like it does this little stair step, which it shouldn't.
Right.
It should be much smoother. The backs of the bones should match more. So that injury could have just put your body into this state of shock.
Yeah. Are we gonna sit up?
Yeah. Let's have you sit up.
I just knew it was trailing down here.
Yeah.
Affecting. All right. You just get so tired of the pain, you know. And people, I don't know, you just like, when you apply for a job, you're like, well, you have to understand I have arthritis and can't do this and that. It just, you feel so old just reaching for a cup.
Even just the little things in our day-to-day that we take for granted become such a big deal.
Yeah. Do I have mascara all over my face?
No, you look great. You're good. She looks good. You're good.
Thank you.
Yeah, you're welcome. This type of relief is something that, like, it's workable. Like, you can get a lot of things done if you take care of it at the right time and place.
Yeah.
Your body's just been needing that decompression, proper adjustments, right? That specificness of the care that we try to provide. Because if you just do the general things and just slap Band-Aids on it, of course you're gonna feel like a broken dam.
Yeah, and you know, ibuprofen doesn't work, pain cream doesn't work, nothing works.
Yeah, because it's the superficial care.
Right?
Yeah, we're really, we got to get down to like the deep part of like the root cause of what's happening, and it's this giant compressive force. Let's work our way back up here, right? Because we haven't even adjusted the neck yet.
I know.
Oh, let's see. Oh yeah, because this right side's pretty stuck. Left side feels very limiting towards the middle of the neck. So let's
Is this where you jump on the?
Yeah, it is. She already knows.
Of course I do.
Yeah, let's go this way. So right away, occiput sticking out to me. This is Even just in the beginning, I was like, this is where I'm gonna adjust. We kind of like bookmark it as we go. So, I'm gonna put you in this nice position here. Lean back against me. And I got you. Good. So, in that car, right, your body came up, hit the roof, everything got pushed down, right? So we're gonna kind of like lift it up instead, because it's been needing that lift. So I'm gonna get like right under it, right there.
Oh! Oh my God!
That was choice.
So, Toledo. I'm so glad I'm not swearing.
Hey, if you need to, you need to. It's okay, we can always bleep it out.
That was amazing. Wow. Woo. Okay.
How'd that feel?
Oh, great.
Yeah. Holy Toledo indeed. And you've never experienced that, right?
Never. Never.
Take your time.
All right.
Yeah, this is a pattern that's been there for a while.
Yeah.
Your body sometimes it just needs to release this like gathering of energy, because I mean the body it's so intelligent and it works in so many ways, and so it can store trauma somewhere, and then even just like the mental capacity and everything, like you start to remember a lot of that trauma even if you're not actively thinking about it. Because has it kind of felt like you've been in that accident for forever?
Yeah.
Yeah.
Right. Exactly.
Good. And then sometimes we just let it settle in. How's that feeling, Susie?
Great, thank you. Yeah, so good.
That was nice. We can do a lift mid-cervical. Relax this. Let this bend. There we go. So the other one was more of a lift. This one's more of a lateral bend inward. So we just change the angle a bit. Turn your palms face up. Lean against me here. Good. And then I just give it like a little pre-tension and follow it through.
Oh.
Oh. That was intense.
It was really good. Never had that.
Let me get you
Never had that. Oh my God.
Here you go.
Well, that was better than that surgery. Oh my gosh, that was amazing.
Definitely much better than surgery.
Wow, I mean, totally different.
Yeah, and you've been following us for a while, so how's this compared to like what you were thinking in your mind?
Yeah, in the beginning I'm like, oh, it's not going to work for me. And then all of a sudden, explosions. It was really nice.
Need a little bit of time.
Yeah.
You need that rapport. That's why sometimes we just want to slow things down, not just in care overall, but like in the moment. And then once we reach that, kind of like that point where we start connecting the dots, then magic happens. Does that feel good?
Yes.
That's looking good.
Yeah.
All right, Susie, we got a little bit more for you.
Okay.
You ready?
Yeah. My little candy store here.
Okay. So yeah, this is some really good spinal decompression, especially after we get some good adjustments in between. This makes it nice and easy to just get more space. A couple breaths in and out. One more. Last one, and you're gonna feel it come up. I like that right there.
Oh, yeah. Oh, all the way down to the bottom of my spine.
Perfect.
Wow, that was great. Oh, I was a little scared about that, but that felt good.
Yeah, it's not too bad, right?
No.
It just looks a little more impressive
my lower
on the videos.
back. Whoa, like bottom of my spine. Wow.
Above, down, inside out is what we like to say.
Thank you so much.
You're so welcome. Here, let me get you up. How's that feeling, Susie?
I couldn't release. I've had a lot of trauma, you know, with a divorce, and then I adopted 3 children from China.
Wow, really?
And I was so close to one of them, and she hasn't wanted anything really to do with the family for about 14 years.
Wow, that's a lot. I mean, that's...
Kills me. You know, you just have to stuff it or put it somewhere else so you can function.
Yeah.
And I adore my other 2 ones. They're so sweet. But
familial trauma
you lose a child, you lose a child.
I'm so sorry about that.
Yeah.
I can feel this has been a pretty heavy burden on you.
Unbelievable.
Yeah.
Just horrible. It's just the strangest thing in the world. You know, you first think, well, what the heck did I do wrong? You analyze your whole life and what you did as a mama, and I cherish her and love her, and she's a wonderful girl. She's wonderful to be around. She's smart, intelligent, and I just miss having her in the family, you know?
I can feel that.
I mean, when somebody more or less doesn't love you, it's a huge, you just live with it.
No, I can understand that. I've definitely had a couple of people take back love in my life, and it's hard. It hurts. Like, it's like a deep-rooted, like, just stabbing pain, I think, more than any physical that you could get.
Yeah.
At the root of it, if you're coming from a place of love, I don't think you're doing anything wrong. Life is hard.
Well, it's increased to nobody really contacting nobody in our family but one sister, and everybody's gone to my daughter and said, what did we do? She said, you haven't done anything wrong.
Yeah.
And yeah, you know, when you're adopted at an older age, things happen to you in orphanages, and the trauma of losing your own family and lack of care. I haven't walked her road, you know, so I don't blame her. I just wish she'd be a little bit more polite. Anyways, but I have 2 other wonderful children, so maybe someday, eh?
I would say, never say never.
Never say never.
Right? Things can change. Time heals a lot.
Yeah.
And I mean, trauma comes in all different forms. So like you were saying, like she's probably gone through a lot too. She's probably trying to do the best that she can with what she has.
Exactly.
And sometimes it just takes that time. Like, I mean, even thinking of like my own experience through life, like I'm a completely different person that when I was 5 years ago, 10 years ago. And like, life teaches you so many things. Sometimes it just takes a little while. That's why everybody's on a different path. But, like even just from the experience that we've had today, like I can see that you're a resilient person.
Yeah.
And you're coming from a place of love, and that's all we can do.
That's all we can do, right?
Yeah. And I'm glad you came in, because this is a part of it. Like, at least if we can help you just release some of that tension.
Yeah. That's
even just a little bit, right. I know that makes such a huge difference in people's lives.
You've released a ton of tension. I really appreciate it.
Yeah, you're welcome. How you feeling overall?
I feel really good. Really good, thank you. And I know it just doesn't end here. I know there'll be more release. So I really appreciate everything you're doing. Yeah.
I just want to see how things are moving. So just turn a look to the left. Let's have you look and turn. That's pretty good. How's that feel?
Yeah.
Feels nice. Turn to the right.
Yeah. Good.
That right side looks much better. Woo.
Yeah, I couldn't do that before.
That feels smooth, right?
Yes.
Up above your head. Ooh, okay. Ooh, and you're already flexible, so. But how does that feel? Cause
it feels good.
Oh, she's going into squats now too.
Oh, yeah.
Extra credit. How's that feel?
Great.
How's the walk?
It feels good.
It looks smoother. Once we start to do like more rehab and you start to do some of like the postural exercises that I was talking about earlier, it's gonna just help stabilize your body more, so that communication from brain to body, right? We just kind of like train.
Thank you.
You're so welcome.
Couldn't wait to get here. Yeah. Thank you so much.
You're so welcome. I appreciate you coming here. Thank you so much.